All right, this video is going to talk about the difference between a flipper, a Nesbit, and an Essix retainer. When a patient's missing a single tooth or maybe two teeth right next to one another, and they're probably going to be going into getting a dental implant, there's that transition time where they would like to have some kind of tooth replacement in there, something that's removable, something that's low cost, and something that's going to get them through until they get the final implant restoration. And so this first screen is going to show an example of what we call a Nesbit. Nesbits are great usually for back teeth. We can make them work for front teeth, but most of the time it's going to be back teeth, either top or bottom. And you can kind of get an idea of how this works. They have a tooth, an acrylic tooth that's embedded into some pink acrylic, or they sometimes can make them clear, and that would just snap down over the neighboring teeth. And those little hooks right here kind of hug around the tooth, both the one tooth in the front and one tooth in the back. So in order for this to work, you do have to have a tooth behind and a tooth in front. Most of the time these days, we're going to do them as metal free. However, these can also be made with metal clasps as well. These are also referred to sometimes as spider partials, just because I guess these arms look like little spiders. But that's what a Nesbit is. And patients can clip them in, they take them out, they clean them at night, they leave them in a jar overnight. Next morning, they rinse them off and pop them back in. Many times they can chew with these, and talking with them is fairly easy. There's another thing called a flipper, and a flipper is typically going to be used mostly on upper teeth. It's rarely used on bottom teeth, although it could work for that, but mostly for upper teeth. And that's going to look kind of like those retainers that kids get when they're finished with orthodontics, but instead of just the acrylic, they're going to have a front tooth put in place. And you can see sometimes they have them with metal clasps that kind of help hold it or keep it retained in place. And sometimes they don't. Sometimes they just rest up there like this, and they have enough surface area that they kind of almost suction cup, but these aren't really that retentive. They seem to have a lot of problems with patients trying to make these things work. Plus, you can imagine having this much acrylic up on the roof of the mouth. It makes it difficult to speak. The thinner we try to make this material, of course, then the more fragile and flimsy it becomes. So we have to make them thick in order to make them work. But then that thickness interferes with the patient's ability to speak. They can get used to it and talk with these things in, although it is a little bit of a struggle. And again, you can see here, this is a flipper that has some metal clasps. Here's a metal clasp again to help keep it in place. And you can see how this would work. They just would slide it into place and hopefully it just stays there. Aesthetically, it's kind of tough, again, to make these things work right, because a lot of times there's not just a missing tooth, but some missing gum tissue height. And so if you just put a tooth of regular size in there, there would be a gap. And so sometimes they have to add some pink porcelain to try to hopefully mimic the shape or at least the shade of the gum tissue. So those have limitations as far as how well or how good they can look. And our last example is going to be an Essix retainer. This is kind of like a bleaching tray, or more like an Invisalign type of aligner, but with white stuff put in it to kind of mimic a tooth. And we can put it in for a couple of teeth, put it in for one tooth, and then they just slide it in, and this is how it looks. The aesthetics of them are okay. Patients can talk with these things pretty good. Problem is chewing with these. They usually have to take these out when they eat, which, if they're out for dinner and they take off their front two teeth to eat, you can see how that just probably won't work. But this can get by for those who are either aesthetically, they don't care about it, but they want to have something in place, or they just manage to work around it. But if they drink something, red wine, a Coke, or something dark, iced tea, it's going to get down inside of here. Food could get inside of here as well. So eating with these is kind of an obstacle. So typically patients don't eat with them, although some adapt to it and work with it just fine. So again, we have a Nesbit, we have a flipper, and we have an Essix. Those are the three different ways that we can replace a missing tooth by someone's transitioning, waiting to go into a dental implant. All right, thanks.